Bacterial vaginosis is that infection that wants to look like candidiasis, but it is not yeast infection. BV or bacterial vaginosis has its own unique characteristics. So if you want to know more about bacterial vaginosis, stay tuned and watch till the end of the video. Hello everyone, welcome to my page and you're welcome to Blissful Life. My name is Priska. Today, I'm going to be talking about bacterial vaginosis. It may interest you to know that bacterial vaginosis is not a sexually transmitted infection, but it can increase your chances of having sexually transmitted infections. It can happen at any age. So like I said, it is more common in women who are in their reproductive age and who are sexually active. So what causes bacterial vaginosis? So normally in a female's vagina, we have the good bacteria. The good bacteria are like the guidance of the vagina. They help to protect, they help to guide the vagina. And also there is the bad bacteria as well. The good bacteria helps to guide the vagina against the bad bacteria. But if in any case, if something happens, the number of the bad bacteria become larger than the good bacteria, it overpowers them, thereby causing bacterial vaginosis. All right. So it's just like a battle between the good and the bad bacteria. Where the bad bacteria wins, then you have bacterial vaginosis. So how are you going to know that you've got bacterial vaginosis? Number one, you're going to have an unusual discharge, which is gray, off-white, or greenish in color. Number two, which is the most which is the peculiar characteristics of bacterial vaginosis, is that you have a fish odor. Okay, your vaginal discharge will have a smelly fishy odor, especially during sex or after sex. You notice that your discharge is having a very bad fishy odor, then you've got bacterial vaginosis. Number three is vaginal itching, and number four is burning sensation and the painful urination and the rest of them. Okay, so now you see it's as if there is a little similarity between candidiasis and bacterial vaginosis, but then I'll tell you the differences. In candidiasis, it doesn't smell. It's just like a white cottage cheese. It's like a white cheese. While in bacterial vaginosis, the vaginal discharge has a fishy odor. Number two, in candidiasis, the itching is much. It is very, very unbearable. While in bacterial vaginosis, you have itching, but it's not as serious. It is not as serious as that of candidiasis. Number three, it is very easy to treat candidiasis infection. It is very easy. You can buy antifungal and just treat it and it goes. But bacterial vaginosis does not go easily. It takes time before you treat it. In fact, you cannot even treat it on your own. You would have to implore the help of a specialist. You have to tell a doctor, or you have to inform your healthcare provider for it to be treated. All right. So like I said, bacterial vaginosis can increase a woman's risk of having sexually transmitted infections, like the pelvic inflammatory disease as well. There is also a connection between bacterial vaginosis and pregnancy. It is believed that if a woman has got bacterial vaginosis, she would have problems with pregnancy, either by having low birth weight children or children that has got birth defects. Yeah. So what is the prevention? How can you prevent bacterial vaginosis? Number one is avoid using scented soaps, perfumes, and all those stuff to put inside your vagina, because there are people who believe, or they want their vagina to smell very well, and then they start putting scents, perfume, scented soaps, just to make the place smell fine. No way. You are interrupting or you are killing the good bacteria, thereby making the bad bacteria in the vagina to multiply, thereby causing this infection. Practice safe sex. Practice safe sex. All right. Use condoms. Use protections. Do not have multiple sexual partners, because you don't know who has what he has. So if you use sexual toys, keep them clean. All right. Maintain special health hygiene. Maintain vaginal hygiene. Clean your vagina. Like I said before, do not put scented soap. If you want to clean your vagina, use only water. The vagina is self-cleansing. The vagina cleanses itself. The vagina cleanses itself. You don't need all the whole shenanigans. You can use water, okay, and very mild soap to clean your vulva and keep it clean, just to reduce your risk of having bacterial vaginosis. So in a case whereby you have treated candidiasis and you still feel you're still having signs and symptoms of this infection, please kindly meet with your healthcare provider. It may be that you're having bacterial vaginosis. And when you meet your healthcare provider, what are they going to do for you? A sample will be taken from you and sent off to the lab for culture and sensitivity. Okay, and then it will be monitored. Now when the result comes out, if truly you've got BV, bacterial vaginosis, you will be given some antibiotic treatment, because from the tests you've done, there are some antibiotics that will be sensitive to this infection. So your healthcare provider will give you these antibiotics for you to get well and for you to get better. So if you're happy with this lecture, I know it is just a general knowledge. It's just for us to refresh our mind on what we know already. So if you're happy, kindly like, share, follow my page, and as well as subscribe to my YouTube channel. Thank you so much, and I will see you in my next video. Bye.